Hello, my name is Dr. Don Buford, and I'm an orthopedic surgeon in Dallas, Texas. I'm the founder and director of the Texas Orthobiologic Institute, and we can be located on the internet at orthobiotexas.com. The handout for this talk can be located at the web address listed on the slide, and this talk is a lecture that was originally given at the 10th annual TOBI meeting, and the title of this presentation is Bone Marrow Aspirate and Bone Marrow Concentrate. This is a 12-slide basic science overview of the differences between bone marrow aspirate and bone marrow concentrate and when we use them clinically in orthopedics. So here you can see my disclosure slide. These are all listed on the American Academy of Orthopedic Surgeons disclosure website, so it's publicly available and updated regularly. We are very active in social media, and we can be reached on all the different platforms at the monikers noted at the right here. You can see here the agenda. We're going to talk about mesenchymal stem cell definitions. I will talk about the cytology of bone marrow concentrate, and we'll talk a bit about some of the cytokines and proteins that are present in bone marrow concentrate. So what is a stem cell? MSC is a term you will commonly hear used in regenerative medicine. It stands for mesenchymal stem cell, as you see here. It's also been recently called medicinal signaling cell, or in addition, we've also come to call these pericytes based on where they live in perivascular locations. Some of the key qualifications of a cell that makes it a stem cell is that it can self-replicate, it is multipotent, stem cells respond to their local environmental signals, and stem cells produce exosomes that contain many of the proteins and other cytokines and products that they export to the extracellular environment. Mesenchymal stem cells respond to inflammation, they respond to cell damage and death, they respond to cell malnutrition, and they respond to infection. And they respond by secreting various factors, exosomes and other proteins, either into the vascular environment or into the soft tissue extracellular environment. Once they are activated, or what happens, or more commonly clinically, is we aspirate these cells and then inject them in a separate location. They then respond to their local environment and produce many, many different factors that have a variety of effects, as you can see here in the middle of the slide. Primary among these effects are some of their anti-inflammatory cytokines that are released. And there are also cytokines released that bring angiogenesis, or new blood vessel or vascularity. There are cytokines released that prevent cell death. There are cytokines released that stimulate the extracellular matrix and prevent scarring. Arnold Kaplan is a well-known doctor who has published extensively on adult mesenchymal stem cells and has a large laboratory experience using these biologic cells. MSCs are present in all MSK tissues, so bone marrow, adipose, bone, muscle, etc. All of these tissues have mesenchymal stem cells. These are indeed pericytes and are stimulated by chemokines or liberated during aspiration. It's interesting to note that although in the lab these stem cells can certainly become any of the tissues listed above, the primary role in our body is paracrine, meaning that it's the factors they secrete that create the responses. It's not that these cells are becoming muscle or becoming cartilage or becoming tendon or ligament. It's that they're secreting factors that stimulate the local cellular environment to go on and heal and regenerate. One of the questions I commonly get is how many stem cells are in bone marrow aspirate? Well, in terms of total nucleated cells, there's 10 to 25 million total nucleated cells per cc. The mesenchymal stem cells are aspirated off of vessels and from the marrow environment during an aspiration, and they range from 0.0025 to 0.01% of the total nucleated cell count. There are other types of cells and items in the marrow cavity and in the marrow spaces, and these include hematopoietic stem cells, platelets, and plasma proteins. Using the midpoint of the average, we can say that there is approximately 17.5 million total nucleated stem cells per cc. And if we use the average percentage of those cells that are mesenchymal stem cells, we end up with a rough approximation of about 1,100 mesenchymal stem cells per cc of bone marrow aspirate. I'm going to say that again. That's about 1,100 mesenchymal stem cells per cc of bone marrow aspirate. Virtually every company in the United States that sells a commercial system for bone marrow aspirate and bone marrow concentrate has a system that can further concentrate the mesenchymal stem cell count from 3 to 6 times over the baseline bone marrow aspirate count. So what that means is we can go from 1,100 mesenchymal stem cells per cc to somewhere in the 3,000 to even 6,000 or 7,000 MSC per cc range after concentrating the bone marrow aspirate and making bone marrow concentrate. In terms of the cytology in bone marrow concentrate, this is data from a publication from Cassano and Fortier in 2016. We can see that the commercial systems evaluated in this study were the arteriocyte and harvest systems. In these columns, you can see the cytology in bone marrow aspirate. You can see these counts here. You can see that after centrifuging, these numbers are improved. They're further concentrated, so that the cellular content is clearly affected by centrifuging the bone marrow aspirate. You can also note that even the platelets can be further concentrated by centrifuging because that's a process that we also use to make platelet-rich plasma, for example. So either system, whether arteriocyte or harvest, demonstrates clearly that the cellular content in bone marrow aspirate can be further concentrated by centrifuging for varying amounts of times that depend on the commercial device being used. In terms of CFUs, or colony forming units, the bone marrow aspirate averages 7.8 in this study. You can see that after centrifuging, we've increased our CFU count by 4 to 5 times in both of these systems. So clearly, centrifuging raises your cellular content if that's what you're interested in clinically. In terms of the cytokines that are present in bone marrow, one of the most talked about cytokines is an anti-inflammatory cytokine called interleukin-1 receptor antagonist protein. You can see in the red rectangle that it's present in whole blood. It's present in PRP. It's also present in bone marrow aspirate, but look where it's the most prevalent. It's the most prevalent in bone marrow concentrate, which again, you receive after centrifuging bone marrow aspirate. It's this high concentration of IRAP that may account for some of the anti-inflammatory properties of bone marrow concentrate. Another plasma protein that may be clinically important in bone marrow concentrate is alpha-2 macroglobulin. This is a natural protease inhibitor that's present in the platelet-poor plasma. We can only access it clinically if we centrifuge the bone marrow aspirate. Otherwise, we don't have a way to access the plasma portion. We can dehydrate the plasma with a filter, thereby raising the concentration of alpha-2 macroglobulin and other plasma proteins. It's important to note that just the process of centrifuging, as typically done in the office, will not raise the concentration of these plasma proteins because they're very small. So it's only the process of dehydrating the platelet-poor plasma that we can thereby raise the concentration of things like alpha-2 macroglobulin and IRAP. Clinically, we have many studies now that show that A2M slows the breakdown of articular cartilage. That's another way of saying that we can slow the arthritic progression in many, many joints by using alpha-2 macroglobulin as an intra-articular injection, perhaps. A2M also binds up pro-inflammatory molecules like TNF-alpha and TGF-beta, and as a result, if we inject this in a synovial joint, it may decrease the chronic inflammatory status of that joint. That may be another mechanism of action that decreases our patient's pain clinically. Less inflammation may equal less pain. It also may allow local cells to thereby go on and heal, whether it's healing some chondromalacia or repairing the extracellular matrix. So this is meant to be a very broad, short 9-minute talk on basic science and specifically comparing the qualities of bone marrow aspirate and bone marrow concentrate. Thank you for your attention.